Welcome to this educational video about pseudomembranous colitis, a serious infection of the colon. We'll explore its causes, how it affects the body, its symptoms, and the various ways it can be treated. This video aims to provide a comprehensive understanding of this potentially life-threatening condition. Pseudomembranous colitis, often called C. diff colitis, is primarily caused by an overgrowth of the bacterium Clostridioides difficile, or C. diff, in the colon. While C. diff is present in the environment and can even reside in the intestines of some healthy individuals without causing harm, problems arise when the normal balance of gut bacteria is disrupted. The most common culprit behind this disruption is antibiotic use. Antibiotics, while effective against bacterial infections, can inadvertently wipe out the beneficial bacteria that usually keep C. diff in check. This creates an opportunity for C. diff to multiply rapidly and release toxins that damage the colon lining. The story of pseudomembranous colitis unfolds at a microscopic level. Once C. diff flourishes in the colon, it produces two primary toxins, toxin A and toxin B. These toxins attack the lining of the colon, causing inflammation and cell death. This damage leads to the formation of characteristic pseudomembranes, yellowish-white plaques composed of dead cells, inflammatory cells, and fibrin. These pseudomembranes adhere to the colon wall, further disrupting its function and leading to the symptoms we'll discuss later. Pseudomembranous colitis is most commonly seen in individuals who have recently taken antibiotics, especially broad-spectrum antibiotics. Hospitalized patients and residents of long-term care facilities are at a higher risk due to the increased exposure to antibiotics and the potential for C. diff transmission. Older adults, people with weakened immune systems, and those with underlying medical conditions are also more susceptible. The incidence of C. diff infection has been increasing in recent years, making it an important public health concern. The signs and symptoms of pseudomembranous colitis can vary in severity. Some common symptoms include watery diarrhea, which can be frequent and profuse. Abdominal cramping and pain are also typical. Other symptoms may include fever, dehydration, and loss of appetite. In severe cases, the colitis can lead to toxic megacolon, a life-threatening condition where the colon becomes severely distended. It's important to note that not everyone infected with C. diff develops colitis. Some individuals may be asymptomatic carriers. Diagnosing pseudomembranous colitis typically involves a stool test to detect the presence of C. diff toxins, a colonoscopy or sigmoidoscopy. Procedures where a camera is used to visualize the colon may also be performed to confirm the presence of pseudomembranes and assess the extent of the inflammation. The patient's medical history, especially recent antibiotic use, is also a crucial factor in diagnosis. While pseudomembranous colitis is often categorized by severity, a formal classification system isn't universally adopted. However, clinicians often describe cases as mild, moderate, or severe based on the frequency of diarrhea, the presence of fever, white blood cell count, and kidney function. Recognizing the severity helps guide treatment decisions. Treatment for pseudomembranous colitis aims to eliminate C. diff and restore the balance of gut bacteria. The first step is often to stop the antibiotic that triggered the infection, if possible. Specific antibiotics like vancomycin, fidaxomicin, or metronidazole are then prescribed to target C. diff. In some cases, a fecal microbiota transplant, or FMT, may be considered. FMT involves transferring stool from a healthy donor into the patient's colon to repopulate the gut with beneficial bacteria. Supportive care, including fluid replacement, is essential to combat dehydration. Preventing pseudomembranous colitis involves judicious antibiotic use. Antibiotics should only be prescribed when necessary and for the shortest duration possible. Strict infection control measures in healthcare settings, such as thorough hand hygiene, proper cleaning and disinfection of surfaces, and isolation of infected patients, are crucial to prevent the spread of C. diff. Probiotics may also be considered to help maintain a healthy gut flora during and after antibiotic use, although more research is needed in this area. The prognosis for pseudomembranous colitis is generally good with appropriate treatment. However, recurrence is a significant concern. Some individuals experience repeated episodes of C. diff infection, requiring prolonged or repeated courses of antibiotics or even FMT. Recent research focuses on developing new strategies to prevent recurrence, such as the use of monoclonal antibodies that neutralize C. diff toxins and the exploration of alternative antibiotic therapies. Ongoing research is also investigating the role of the gut microbiome in preventing and treating C. diff infection, paving the way for more targeted and effective therapies in the future.